I'm Dr. Todd Schlesinger. This is the Dermatology and Laser Center of Charleston. We've been open here for about 4 years, and we recently were introduced to the PrimaryRx system. We found the system very easy to use. We have a lot of patients who are really enjoying it. What we find is that the patients love to save time. They don't have to go to the pharmacy. They can pick up their prescriptions here. They can use their copay like they typically do at any pharmacy. We find it saves them a lot of time. One other thing about the program is we have one staff member that runs the program at the front. She does a great job. We really don't have to interact with the program very much anymore. Once we got everything set up and organized, it seems to run quite seamlessly. We just take the medicine from the cabinet, write the patient a prescription, and send them up to the front desk, and it works quite nicely. We definitely have found that the system has increased our practice revenue beginning for the first few weeks. We could already tell we were starting to make a little bit of extra profit with the system. So if we can do that and also help our patients save time, money, and increase compliance, we'll be very happy, and we've certainly appreciated it so far.
Hello, my name is Jeremiah Brown. I'm administrator here at Palmetto Primary Care Physicians. We're a 19-location family medicine practice. We've been using PrimaryRx since the beginning of 2009. Beginning of the year, we piloted in our after-hours clinic, and by the end of this year, we'll have 4 locations running the pharmacy program. We've tried other pharmacy dispensing programs a few years ago, more of a cash and carry basis, and the biggest difference between those programs and PrimaryRx has been our ability to bill the insurance company. It has been a huge factor in enabling us to take some of the administrative burden off the offices. It is like another service line. You can look at it as revenue, extra revenue brought in either through like an EKG or to conducting IVs in your office. You can have an expectation in where we've experienced between $5 and $6 of profit per script. Great part of this also is being able to use the e-prescribe function through our EMR system, cut down a lot of the paperwork. It also helps us alleviate some of the phone calls and issues that we receive from pharmacies trying to figure out what kind of script we're doing, because we're already dispensing within our own facility. This enables us to basically circumvent a lot of administrative problems that go in with dispensing and treating and addressing the care for the patient.
Hi, my name is Leah. I work at the pharmacy counter. We've been doing it since about August. I do all the dispensing. Patients seem to love it. It's super, super easy for me, and they love the fact that they can just come to me, get their prescriptions. They don't have to go to the pharmacy. Out of every 10 patients, we dispense, I would say, about half.
Steve Thomas, Medical Director for the Extended Care Clinic at Palmetto Primary Care. We have been using the program here long enough to become truly comfortable with it. It is wonderful, fantastic for the patients. They come in, they get a diagnosis, they get their medicine, they go home. Very often I see patients without insurance, and so for self-pay patients, perfect. We can save them money over their pharmacy. For the patients with insurance, we can give it to them the same price, and we can save them an hour, maybe more. As far as integrating it into the practice, not a hitch. It was a little difficult for the staff at first with the insurance processing, and just a level of comfort that came to them really fairly quickly. And so now often I will tell them what I'm writing, and they'll have it filled before I finish the chart and done the prescriptions. So it's a very, very fast service, wonderful for the patients, and I very, very highly recommend it.
Hi, my name is Crystal Wells, and I work at Health First Rapid Care, one of our urgent care centers here in Charleston, South Carolina. On many days, we will see between 200 and 250 patients a day. In doing so, we will fill between 60 and 80 scripts, and that is quite profitable for our practice. We've had this system in place for right at 3 years. We started out with a cash and carry system, which was able to bring in some revenue, but when we switched over and were able to adjudicate the insurance claims, that's when we really started seeing a higher volume of scripts and a lot more profit coming into the practice. If I see a brand new patient that I have never seen before, I can have their insurance information, demographics, the prescription filled, them in and out the door within about 4 minutes. So it is extremely quick and very simple.